Listening to podcast is no replacement for real training. While we attempt to provide accurate commentary, we hold no responsibility on how you use the information we provide. Get medical training. In the blink of an eye, everyday order can be replaced with once-in-a-lifetime chaos. Be prepared. This is the Civilian Medical Podcast.
Hey guys, welcome to another episode of the Civilian Medical Podcast. My name is Dietrich. I've got my good buddy Sean with me, who is the brains of the operation. I'm just here for the comedic relief. So, how are you, buddy?
I think you got that backwards, actually. But that was actually a joke. So now you're the smart one and the funny one. Get out of here.
Come on. Yeah, they asked me to speak at the upcoming South Carolina paramedic symposium, EMS symposium. They're like, "Hey, can you speak on podcasts?" And I was like, maybe. I can do that. So
there you go.
I'm speaking on podcasts, and I'm not the podcast expert. So I'm just gonna record Sean and have you talk during the podcast.
Okay, that's probably a terrible idea. So I did a presentation at the Professional Outdoor Media Association on podcasting, and they're traditionally older generation kind of print media and outdoor media and things like that, but not really any new media. And I didn't prepare anything. I knew about it for a year in advance, and I just went there, and the night before I wrote down a couple notes, and then I just got up there and talked for an hour, and it was the most rambling, incoherent thing that anyone could possibly have ever imagined. And so don't rely on me for that kind of stuff.
Well, we have my friend Katie. She's been on my other friends, Chris Ruggerio's podcast, the Medic Up podcast. And so him and I are both doing them, Katie. We're doing the podcast thing for the South Carolina EMS Symposium. So it should be entertaining for us to be up there. We'll just be rambling, kind of like we do here on the show.
Very cool.
That'll go well.
So who is our guest, Dietrich?
So Katie, I met Katie a couple years ago at the TAPMed competition. I stalk her on Instagram, and I'm super jealous of what she's doing in Texas and teaching and things like that. So I invited her onto the show.
Very cool. Katie, tell us just a little bit about yourself. How'd you get into medical stuff?
So I am, obviously, Dietrich said, I'm in Texas. I've been a Texas paramedic for 16 years, 17 in August. And then I've been teaching for about 12 years. I just started doing the Stop the Bleed stuff, I guess, 2017. And that's predominantly what I do in the public now. I do teach for our local college, but most of what I do in the community is the Stop the Bleed stuff.
Very cool. That's pretty awesome. How'd you get into Stop the Bleed? Was it just kind of a natural progression, or was that something that you sought out, or did someone suggest it to you?
It was kind of one that I sought out after being out in South Carolina, because I actually went to that same year, 2017, I went to the South Carolina conference, the one Dietrich's talking about. I actually went to that beforehand, and then came back in the summer for SOMA and met everybody at that conference. But after that, I started looking more into it and how to bring it to our area, because we don't have anything like that. And we have the alert center in town with us, and we still don't have a lot in the community, or didn't have more in the community.
Did you, so you decided that you wanted to do something. Was Stop the Bleed, was that the first one that you saw, or did you kind of evaluate a couple of different ones before you decided to settle on that?
No, I started just with Stop the Bleed, but since then I've done the first care provider. I've gone through their class and their instructor, kind of the development class, which I think is great. And really, I think more of our instructors should go through it, just because it gives you more refined and an actual goal, and people aren't just out there telling whatever they want.
Yeah, that makes a lot of sense.
Katie, you and I both have talked about the difference between teaching EMS folks and teaching the public. How we both really enjoy teaching the public more honestly, because they're there to learn, they're there to soak up the knowledge that you're there, and they're better. I think they're more fun to teach.
They are, for sure. That's the last, I guess, 18 months I was in our training department before I went back out into the field. And it's miserable teaching your coworkers. Like, they're great, and they're super smart, but a lot of them for CE, it's the same info over and over, and they like to let you know that they're forced to be there. Whereas the stop the bleed stuff, especially in the public, they want to be there. They're there to learn, and they're super, super interactive. So that's way more fun.
Definitely. I mean, Sean, you know too, like people are traveling for these classes a good bit. I mean, they'll travel across state lines to come to a class, a civilian class, but then teaching like regular EMS folks, like they don't want to pay for education. They want to be in and out as quickly as possible. Like they're like, just give me, I just want to restart my card. They don't really there to learn new stuff. So, I mean, I've got people in my southeast that'll travel across state lines, a few, days, hours away. So the public is definitely more fun to teach.
Yeah, and they're super motivated too. Last weekend I had a class and I had a guy driving in from South Dakota to Colorado for that. I taught in Georgia over the summer and had someone drive from Michigan to take that class. I'm like, dude, I'm coming to Michigan. Like, you could have just saved a lot of time. But yeah, the public, they're super into it and super motivated to get that knowledge and experience. I can imagine. I mean, so like EMT paramedics, people in the medical field, they have all this training that's kind of available to them, and they're required to take some continuing education and stuff like that. How does Stop the Bleed kind of fit into that? Because generally, Stop the Bleed, I think a lot of people kind of see it as, oh, this is aimed towards just like people, teachers, just general public stuff. And then to talk about actually teaching that to medical professionals, even though they don't want to be there, what has been their reaction and response to it?
Focusing a lot on the hands-on. So I have a lot more information, mostly from Deployed Med website, and I share that app with them as well so that they can continue looking things up. But making it more medicine-based and providing the why more so than just, here's the skill, you should do this. Showing them why and what's going to happen when you don't do it. So letting your patient get cold, things like that, and why you don't want a little bit of blood going through. And so things like that, if you can show them and then show them the resources behind it, they're a lot more receptive to it. And they all love the hands-on.
I can't imagine. Yeah, I can imagine. This is a question for both of you. Like in all your paramedic training and stuff, clearly you have clinical hours and on the rigs and things like that. But how much of it is hands-on and how much of it is actually just sitting there listening to someone drone on or doing your own studying or whatnot?
When I went through paramedic school, it was a lot of PowerPoint by death. I mean, you were like, oh my gosh, like I'm tired of looking at these PowerPoints. We would go through chapters. I'm like, oh my gosh, I'm tired of this. I just want to, I learn better by hands-on. Some people learn better by auditory, whatever, but I learn better hands-on. And, compared to like Stop the Bleed, when I went through paramedic school, tourniquets were a last resort. We was like, all right, we hold pressure, we elevate, you put, a pressure point, you maybe think about calling a doctor, and then you put a tourniquet on. They're going to lose their arm or their leg. Like, it was a complete last resort to put a tourniquet on. And wound packing was not even an option for wound packing. When first time I did wound packing in the field, like I got phone calls and the doctor looked at me like I was crazy. Like, I was like, oh, the gauze just fell down in there. Like, that's the way I had to talk to the doctor. I was like, oh, that roll of cling is just rolled really tight and it fell down into the wound. And the doctor started laughing because we weren't allowed to wound pack. It wasn't in our skills. So to bring that to EMS people now and say, look, you can wound pack. We can use hemostatic agents or we can use regular gauze to wound pack with. And yes, don't be afraid to put a tourniquet on. To go to law enforcement officers and like, don't be afraid to put a tourniquet on. That's a big deal.
What about you, Katie?
It was the same when I started. We actually had somebody who put fingers in a wound and they were trying to measure it, but this was like years ago. And that started all kinds of re-educating for people. And this is like 2008-ish. So it has definitely come a long way. So.
Tell us about the structure of Stop the Bleed classes. Like, what do you teach in those classes?
So the biggest thing, identifying life-threatening bleeding. So, and making sure that you're safe, because, everybody wants to run in and help, or at least they think they do, but dead rescuers not rescuing anybody. So trying to convince people to be safe while they're helping other people, but identifying life-threatening bleeding, and then straight into how do we stop it? Or just whether you're going to choose a tourniquet or try direct pressure while you're getting your tourniquet, or where it's at on the body. Because I've seen several classes that show the core of the body, and they show wound packing on the core, which you're not going to do. And if you're just going through, clicking through slides and showing them that, it confuses them a lot. So
Yeah, I call that a gauze pneumothorax.
That's the class I taught this morning. I was talking about packing, and I said, well, if I'm inside the circle, if I fill that full of gauze, what's going to happen? So, and that eventually, once they actually have to think about it and picture it, then it makes a lot of sense.
Yeah.
So in my class, I talk about how we seal neck to nuts. And so like, that's what we say, like neck to nuts, you seal it. And we taught a class, and then about a month later, I get an email from this guy, and he's like, you said something about neck to nuts. What did you mean by that again? I'm like, okay. So but at least they remember, like neck to nuts, I'm supposed to do something else. Like,
nice. I tell them, put fingers in holes, you're going to make friends. It keeps their attention, because that's, so far into the class that they kind of fade out a little bit. That's usually how I bring them back, and then they're super confused for a second. And
right. They're like, wait, what did you say?
Exactly.
Which wound packer are you using? Which trainer do you like the best?
So the ones that I use for most of my classes, I use the Wound Club, and that one has worked really, really well. And then I use the True Clot trainer as well, are my two primary. And then for dry stuff, I'll put out, because not everybody, I can't convince everybody to get bloody. So for the ones that I can't, I put out my Tech line. I have 4 of those, and I'll put those out and get people to feel the bone shards and things like that.
Very cool. And then obviously the tourniquets, you've got trainers of those. You've got those well organized. We'll talk about your favorites here in a little bit of those. I want to definitely dive into that. And then your pressure bandages, what are you training with on those?
So I'll show the Israeli, and because I'll actually show all 3 of them, but I like to have Leonid, when I'm in the state and he's here from Percy's, come out and show it, because he shows not just the wrapping, but he shows everything else that the Israeli bandage can be used for. So, and he gets so into it, it's really fun to watch. But I really, really like the battle wrap. So from Combat Medical, that stuff is impressive. And it's always fun in classes to try to get people to tear it. And then just being able to see through it and see your wound, I think is super, super helpful.
And who's your primary target for your classes? Like who are you trying to reach with those? Obviously the public, but is it churches, is it businesses? Like what are you trying to reach there?
So most of what I've been doing, since the summer, has been schools. So we got most of our educators in San Marcos. The one I did today was at a private school in the northern part of our county. And they're just trying to be ahead of the curve. So they know eventually it's going to include them for the House bill that requires the Stop the Bleed kits. So they're trying to be ahead of that and get everybody trained early on.
Awesome. I was going to ask about that. Do your local schools have kits, or are they kind of just working on their own now?
They actually, pretty much all of them have at least one kit. So with the House Bill 496 required the Stop the Bleed kits to be in schools, but they made it where the administrator can decide how many and where they go. So hopefully that'll eventually get amended to give them, a little more guidance on how many they should have, because one tourniquet for a huge school in the nurse's office, it makes it a little bit more difficult. But with that, our schools are really good with it. And a friend of mine, Philip, before he passed, he took care of all the Hayes County schools, and he did an amazing job with them. He has one Stop the Bleed kit in every classroom for the
That is
county.
awesome.
He did a great job with that.
We have the same thing in South Carolina. We have Jacobs kits, Townsville Elementary School, named after that young kid. And so every school has one kit, and it's from TACMed Solutions. So they have a soft tea, they have a pressure bandage, have some hemostatic dressings in there, things like that. So it's a start. Obviously, like you were saying, we'd like to see a kit in every classroom. That would be nice, but at least one inside the school is a start somewhere.
Yeah, for sure. And getting them to just buy into the training has been great. And that's with our summer classes. We had a principal in one of them, and as soon as we finished class, she was asking her safety guy, why do we only have one? Why are they not everywhere? And he was trying to explain they're working out funding for it and how to get more. But just going through the training, I think, helps a lot of people see the need.
Definitely. Going back, you said you can't convince everyone to get bloody, and I thought that was kind of interesting. Like, so there's people that come to the class and they don't want to get involved in that. Really, they just want to.
Yeah. Well, they'll jump right in with tourniquets and stuff like that, but they don't want to do the wound packing so much. But what's super helpful with that is using the Focus Clear Blood with their clear trainer, and people are good with that because it's just the seeing what looks like blood kind of freaks them out a little bit. But if they can get around it another way, and I want them to at least get hands-on and get the method down. So if I can teach them on the clear ones, that's a whole lot better.
Yeah, for sure. I just thought that was interesting. Sorry, Dietrich, because like in my classes, the blood is why they're there. I'm like, dude, get your face out of there. Just stop.
Yeah, that's a good point. I had a teacher, we were doing the wound packing, and she literally was gagging as she was wound packing. Like, I really thought she was going to vomit right there. And I'm a sympathetic puker. So if she would have puked, I would have puked. And so a couple other dudes that we were teaching with started laughing because they were trying to get her to throw up. And I'm like, stop. Like, if she throws up in this classroom, I'm going to throw up. So, changing up and going to clear liquid, maybe that's a good idea. Are you making your own blood, or are you...
I do make my own for the most part.
What's your recipe? We got to know.
It's nothing fancy. I'm just using one of the ones off of the TechMed Solutions group, the trainer group, and it's just the paint, finger paints and water, and then I'll add in the Caro syrup to make it thicker, and then occasionally I'll do the dish soap, like just a little bit of dish soap to make it slippery. But
Sean's got a funny story about that.
So here I am in Georgia, and Dietrich and I are doing a Stop the Bleed, just like clinic or a workshop, I guess, for a bunch of gun people and YouTubers and things like that. And he had been telling me previously that he started using like an edible Caro syrup and food coloring and chocolate. And so he told me that a few weeks before. So when we get there, I'm like, oh, I'm going to taste it. I know it's gross. Whatever. I'm a pig. I don't know what to say. So I taste it and I'm just process for a second. And then I just start spitting it out because it was soap. He had not brought the edible one. He had brought soap. So I just got a big old thing of soap in my mouth. Yeah.
nice.
Yeah. It was not good. I still taste things. It hasn't stopped me, but I definitely put some thought into it now.
I tried the Diet Coke with chocolate, and I couldn't wait long enough, I guess, for my Diet Coke to lose all of its, I guess, carbonation. Yeah, so that was just not gonna happen.
I use dish soap, just the big thing of blue dish soap, and one tube of red food coloring, and it works really, really well. First off, like it's slippery and viscous, and it flows well. But on top of that, because of the soap, like it doesn't really stain anything.
Right. It's I have the True Clot stuff as well, the True Clot blood and the True Clot gauze, because for some classes that works a whole lot better, but it's expensive to use it for any large amount of people.
It is, because not only do you have to buy the blood, but you have to buy the hemostatic gauze that that reacts with the blood to clot. It's awesome, but it is super expensive.
Yeah, I wish it was more affordable. Like I love when you start seeing it clot, like clots are coming out of the wound.
Right.
I think it's awesome. I just wish it was more affordable that you could provide that with every single class. I mean, you'd have to up your price, or to start charging some for it if you were going to use that kind of stuff for every class.
Yep.
Let's talk real quick, kind of about purpose. Doing these classes is one of the most rewarding things that I do. And when you see people, like, because we do scenarios in our classes and things like that, and I believe Stop the Bleed is similar, possibly. But what about like the rewarding factor? Like clearly it's a job and there's things there, but what about like what you do, just teaching people how to help and teaching people how to keep people alive until that next level of care gets there? Like, how rewarding is it?
I love it. This has been my favorite class to teach, because I have an EMT class as well. And I do like the normal AHA stuff like that. But this has been my favorite class because the knowledge is not new, but it's new to a lot of the public and everybody that I get emails thanking me for the class and things like that. And it's awesome to know that they're able to use it. I actually got a email a couple weeks ago. We had a shooting downtown and just random drive-by, but one of my students who actually helped me teach a class later put on the first tourniquet. So he happened to be there doing security and was able to help out, and he sent me an email letting me know, and that was like, that's awesome.
Yeah, that's so huge. Let's talk a little bit about gear, right? Like we know classes are out there, but let's talk about some of your favorites. Dietrich, where do you want to go there? Hello.
Hey, sorry, my internet is really screwing up.
Let's start talking about just some favorite gear and stuff. We all have our favorites. I'm curious as to what Katie's are, and Dietrich, take that wherever.
Yeah, so we all have our favorites. I've gotten called a cat fanboy, things like that on Instagram, which maybe it was probably Sean doing it, but
I've got 10 accounts.
Been told that I was in Nar's back pocket, stuff like that. But anyway,
also me.
Yes. Katie, what's your favorite gear?
So, starting with tourniquet, it really depends situationally. Just who you're teaching and what they're more likely to use. What's in my child's backpack is a cat. So that's what she's got on her, what she'll take to school, because she can actually put that on. And I've done video with her putting on the tourniquet and stuff before. But I mean, there's things I like about all of them, but in what I carry with me are typically, I think in my truck right now, I have 2 cats, soft TW, and then 1 TMT. So I just carry those 3, just one of each of them.
I really like the TX2, TX3. Like those have kind of grown on me a little bit. Like we carry the cats in my search and rescue bags, but we also add, we're looking at adding the TX2 or the TX3 for that long-term care, prolonged field care kind of stuff. So I'm kind of liking that one too.
And I talk about the time stuff for my people, like today's class, where they're not in the wilderness. They're super close, like from Austin, but for us to get to them, some of the responses are like 20 minutes, half an hour. So I talked to them about doing stuff like that. And this is a school that goes kindergarten through 12. So we talked about different size and stuff like that for them.
Definitely. In my truck, there's soft teas and there's cats. We started carrying the TMTs, looking at those, the TX2 or TX3. The TMT, I like that one because of the junctional edition they're hopefully going to be coming out with. Like that's, to me, is going to set that tourniquet apart when you can make that tourniquet a junctional tourniquet as well.
I really like with them that it's not dependent on the Velcro. So you can totally get caught on something, lose your Velcro off of it, and it still holds the pressure. And I think if you're having to move people around, that becomes huge.
Definitely. So we talked about pressure bandage already. What's your favorite chest seal?
So right now, what I wish we would carry on our trucks would be the hyphens, just because that's the one that I use the most often in my classes. I did a video with the Fox seal from Combat Medical that it worked really, really well on the tech line trainer and just showing that. And so I'll do that in class. I have some of those that I can show, but I'm hoping that we'll go to the hyphen, because the shooting that I had the other day, and it was super, like, he completely missed the lung up in his shoulder, but we have Vaseline gauze still on our trucks.
Like every
And-
truck like every ambulance in
yes.
America.
Yes. So that's, and we've had enough shootings and stabbings lately that I think that'll change. We'll be able to push for having an actual chest seal instead of me trying to duct tape down the packaging.
Those things
So-
are awful. Like once you've used a hyphen chest seal on someone who's diaphoretic, pouring sweat, or has like a hairy chest or whatever, like you just slap it on, they work
Right.
great. So, but yeah, every ambulance in America, just due to budget restraints or,
Oh, yeah.
has, hyphens are retailing for about $15, $16. Petroleum gauze is $1.50.
Mhm.
So budget issues, I get it, but man, it's nice. So the system I work for has hyphens. The largest system I used to work for, we had petroleum gauze. So I was like, oh, this is nice. I don't have to use my own hyphen chest seals. Like I used my personal hyphens on a pregnant lady who got shot one time. It was a large wound into the abdomen. She was very pregnant. And I was like, cool, well, I'm going to use my own hyphen chest seal on you, like just to kind of, provide better patient care for you. So yes, so we got that. Are you CLOX or combat gauze?
Oh, damn.
Oh, this is getting serious now.
So kind of depends. What I used the other day on the guy, I didn't pack his wound, and actually what I've used twice lately for just bleeding things was the quick clot, just because that's what we had handy. But we are changing out all of our quick clot to Celox on the trucks.
Dang.
Hope Z-Medica's not listening right now. I'm gonna get I'm gonna get a phone call.
Well, I tell them I don't make those decisions. I don't sign things. I don't sign checks.
Yeah, I'm gonna send me your email address. Like, oh, this is Katie's email address. Talk to her.
Nice.
But yeah, like our SWAT team carries combat gauze, but on the ambulance we have CLOX. So I've used both. Both worked well. There again, like if you talk to Fisher, like he'll just take some regular compressed gauze and go to work. So, but he's probably packed a lot more wounds than I'll ever even think about. So we're good with that.
Yeah, for sure. What about let's see, where are we at? Dun, 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 dun. I think that's all the really juicy stuff, right? The other stuff's just kind of like secondary and sits there. What kits do you carry? What compact kits, or just like what trauma bags do you have around? Multiple?
Yeah, I was just saying multiple. I did inventory this weekend. Just
You're such a nerd.
Yes, that's exactly. Be quiet, please. That's so I went through all of my kits, and I probably have 5 or 6 different ones. My daughter brought the Mal outside.
Oh, good.
So yeah, that's always. But the ones that I typically have in my gear that go with me regularly are I have the blue line from Combat Medical, and then I have a Ocho Mini IFAC from NAR, and those are the ones I usually have with me.
Very nice.
So they fit in my backpack.
Nice.
Yeah, sure. That's too, like I always want to make sure I have a kit with me. So whether it's an ankle kit or something in my backpack, like generally I'm surrounded. Like right now I've got this Mobilized Rescue. Have you seen these?
I think I have him on my LinkedIn account that I've talked to him.
They're interesting. This is the one that they have an app that will guide you through using everything in there. I had some interesting findings that we're going to talk about in a future podcast, but I used it in a class and gave somebody who had been through the entire class the kit, and they became so focused on the app that patient care was awful.
Nice.
So it was kind of interesting to see that. I'm going to give it to someone brand new who has not been through the class next time and see if they're a little bit better with it. But yeah, interesting stuff. It just goes to show that like taking one of these classes, one of your classes, is so incredibly important, because having that knowledge, even if they forget some of the things, they're going to remember so much of it when they have to respond to something traumatic.
Mm-hmm.
Have you?
For CPR stuff, I've been trying to get people to download the metronome apps.
Yeah.
Because we actually had to when I was at one of the EMS classes I went through, and they had everybody go through and download. It didn't matter which one you did, just so that you would have that metronome and get used to actually doing enough compressions.
Yeah. I just downloaded the Staying Alive MP3.
The data's there though to show that we do really crappy CPR until the metronome gets turned on. You're like, oh, you can see the data. Like my system that we pull the data on, you would see like crews are doing really crappy CPR, and then you're like, oh, the monitor turns the metronome, or the metronome gets turned on, and all of a sudden, boom, the data's back, and it's really good.
Yeah, I didn't know for the longest time that our monitors did that. So, because we have LP15s. And when we started going to, that's mandatory now that you turn that on at some point. So
very nice. My system is Team Zoll, so we're out.
So Skinny Medic was telling me that you're like incredibly organized as far as your med gear and stuff goes. Like, how do you stay organized, and how do you recommend that people organize their stuff?
So part of it, I think, is knowing what you have. So like the whole inventory thing, I figured out I have 125 tourniquets.
Yeah.
And they're across all the different brands. And I mean, because I have some of the, like, I have a couple rats that I use as tie downs to tie the rest of my stuff.
Ooh.
Into the box, and that's what I use my stats for as well. They make great tie downs.
We're getting sued on that one.
So they work great for that. But just I have everything separated. So all my cats are actually numbered. So usually they're in their box in numerical order. The other ones are not like that. I just try to keep them all together, keep them neat. But then almost everything has its individual box. And just that way I can see it. And that's the biggest thing for me, being able to see stuff and grouping like things together. Because that's how I end up packing to go to a class, is liked things.
Yeah, that is way more organized than me. I'm actually proud of myself because I've got a couple of recon tourniquets in class just so I can see what prolonged use and multiple application does to them. And I put a little tick every time they're applied in class, and I'm super proud of myself for that. But yeah, no, I am not the most organized person, as anyone who knows me could tell you.
I have all my training supplies in one Pelican case, if that counts. Like, it's all just thrown in there. Like,
well, it's all together.
Yes, it is. You just get to class, we turn it upside down, we dump everything in the floor. Like, all right, this is all like bleeding control. This is airway. This is respiratory. Like, we group it all of our supplies together. We're ready to roll. So,
I'd
go crazy.
Yeah, it's true. I was just gonna say I saw it in Georgia. I saw his face. I have all mine in one room, if that counts. And I do have like a big, huge gallon Ziploc bag of the things, of like, brand new copies of the things that I talk about in class. And it's got like an itemized list on it. And after every class, I go through and put everything back in that bag. That way I'm not searching like, oh, I know it's around here somewhere. But other than that, no, I'm a disaster. I love it. So how do you pack your kits? Let's just say that you just have something that's about this size, and I'm showing her the Mobilize Rescue. Like, how do you pack it to keep things, the stuff that you're going to use first, and like, do you have any kind of strategy to that?
I don't on those. I have on a couple of mine that I just bought the bags like through 511 and did it myself. It's really just so that the tourniquets are facing out, and then just kind of going from extremity to inside the body. Mm-hmm. So that's for the most part just layers.
Does Stop the Bleed teach March or ABC or something different?
It's kind of on its own because it has ABC, but it doesn't flow that way. Their ABC is alert, bleed, and compression. So, because when I talk about that in class, I tell them, like, medical people like acronyms. So here's another one that was also something else. So,
and then first care provider has care.
Yes, care and race.
Yes.
So I actually, on the last slide of my Stop the Bleed stuff, I put in the 3 apps, and I have Stop the Bleed app on there, First Care Provider, and Deployed Medicine. And on the Stop the Bleed, because that app is kind of hard to use. It's almost like a choose your own adventure kind of thing. and that's what I tell them. And most of my classes have been old enough that they understand that.
Mm-hmm.
So they get that. But then, like First Care Provider, just having the race and care, being able to follow that through a little bit more, I think that's helpful to people.
Definitely.
So coming up soon will be Stop the Bleed Month. We started with Stop the Bleed Day, which was pretty cool. We saw a lot of people take the class across the country, and then they kind of expanded to Stop the Bleed Month. What do you have anything special planned for this year?
Not yet. We're looking at expanding it because I guess last year, for 19, we had 10 in-house classes, but those were scheduled around the stuff I was already doing or already scheduled to do community-wise. So this year, I think we're going to focus more on the county and getting our people in and getting them through it. So
that's awesome. Yeah, it was fun, and we've done public stuff where we've done free classes, and we've done, like we're going to work on training the firefighters. We're going to get them trained up and stop the bleed, things like that. So just kind of what we focused on here locally last year was in different fire departments. We're going to offer you free classes. You're in service that month. We'll come and we'll do it. So that was fun. I think it's a cool initiative. You can look that up on the internet. You can Google it. I don't have the website right offhand, but bleeding control, there's a lot of free classes that are around the country during that time frame. Sometimes people do have to charge for these Stop the Bleed classes. They're usually pretty cheap, or but some people do them for free. So you can definitely find for free that during that time frame.
If you had to sell people on a Stop the Bleed class, how would you go about it?
I just tell them you could be the one that's there with them. Said we're not going to stop bad people just in general. You're not going to stop people from hurting other people, but you have a direct effect on the dying. We can fix that. So
yeah, I like that a lot. Direct effect on the dying.
Nice. That's cool.
Yeah, no, that is actually pretty great. And how would you describe the people that come to your classes? Like what walks of life? Is it, one socioeconomic group, or is it kind of all over the place?
No, it's been actually all over the place, which has been really fun. Because one of I used a lot of Facebook advertising for Stop the Bleed Month. So we posted in a mothering group, and the mothering groups are interesting just in themselves on Facebook. But so I got different moms and they brought their kids, and so that was a lot of fun. But then I also had some that their children are EMS fire, like out of state, and told them, well, you need to find a class. So then I've got people in their 60s, 70s coming out as well. And those are a lot of fun too, because they can actually talk about, back when they were a bad thing and how they were taught. So, and that helps me too. It gives me stuff to build off of.
Absolutely. No, that's actually really awesome. So how can people find your classes and register and take them and all that great stuff?
So for my own website is comeandtakeitcpr.com. And that's my own business. And I still don't charge for those classes in that one either. But once start registering more for the actual Stop the Bleed month, it'll be up on the I guess it's bleedingcontrol.org website.
So you run a business that you don't charge for classes?
I don't charge for the Stop the Bleed.
Okay, I was like,
yeah.
I'm not the best business person, but like how do you make money?
I don't think that works. But no, so I'll charge for like the AHA and stuff like that.
Perfect.
But I'll go out and do Stop the Bleed for free.
Awesome.
That is awesome. So comeandtakeitcpr.com, right?
Yes.
All right.
And where else can they find you at on the internet?
I'm on Instagram, and I think my Facebook is the same one. It's just KM Contreras, the number 8.
Awesome. Yeah, go follow her on Instagram. You'll be super jealous of her kit layouts, her class designs, and how she has all of her things organized on tables for classes. I'm like, oh, I wish I was that organized.
Gotta have it in order, and most of it's grouped by product and then by size, so that my lines match up.
Okay.
That is awesome.
So,
I know. I'm just gonna go post a picture of like my tourniquet pin and send it to her.
I think I've posted like some of my randomness, and I think Katie's commented going, I'm stressing her out by the way my stuff's organized.
Oh yeah, she'll just be like, lock.
nope, can't do that.
Oh, that's awesome, Katie. Thanks so much for joining us.
Absolutely. Thanks for
Thank
having
you.
me.
Very cool. Keep up the good work. I know people out there appreciate it, and they're starting to take notice. Actually, have you noticed that people are getting more concerned?
Yeah, that's the class today was the security. They don't have SROs for the private schools, but he got hired on contract as security, and he's been watching it. And he said, being private school, they've got to send out the letter to the parents and things like that. And he said they didn't have a whole lot of buy-in from parents. So they're trying to approach it from the teacher side and look, this is what it's doing and this is why. It's not just mass events. This is everyday stuff. And they're a little more receptive to that, and they're coming around to it. But I'm glad he's trying to work that early.
Yeah.
Get that going.
Totally agree. All right, Dietrich, would you like to sing us a song to take us out today?
I think that's your role.
No. Dang it, no. I'm not talented at all, actually, it turns out, after the show. All right, that's awesome. Katie, thanks a lot. Dietrich, I'll talk to you in the next episode.
Thank you.
Find us and subscribe at civmedical.com.